Millions of seniors slowly lose healthy blood flow to their legs without realizing it, until the symptoms begin interfering with everyday life. It often starts with subtle warning signs. Your feet always seems cold. Your legs tire much sooner than they used to. You develop cramping when walking. Or you begin noticing numbness and tingling that you simply blame on getting older. But here's what many people don't realize. These symptoms aren't always caused by poor circulation alone. In some cases, a commonly overlooked vitamin deficiency may also play an important role in how your legs and nerves function. Today, I'm going to explain what that vitamin is, why so many seniors become deficient, and how to recognize the warning signs. What you can start doing today to support healthier leg circulation, and when it's time to seek medical attention. One of the biggest mistakes people make is treating the symptom instead of finding the cause. Before you spend money on expensive supplements or circulation products, it's important to understand what's really happening inside your body. Healthy leg circulation depends on a healthy heart, flexible blood vessels, healthy nerves, strong muscles, and good overall metabolism. As we age, arteries naturally become stiffer. Years of high blood pressure, elevated cholesterol, diabetes, smoking, and inactivity can gradually reduce blood flow, while nerve problems can produce symptoms that feel almost identical to poor circulation. That's why so many people become confused. So, let me ask you a few questions. Do your calves begin aching every time you walk a certain distance and then improve after you stop and rest? Are your feet always cold, even when everyone else's feels comfortable? Have you noticed tingling, burning, numbness, or loss of feeling in your toes? Have you become less steady on your feet or noticed that your balance isn't quite what it used to be? Do cuts or sores on your feet seem to heal more slowly than they once did before? These are all important clues that deserve attention. One vitamin that many seniors overlook is vitamin B12. Most people think of vitamin B12 as simply an energy vitamin, but it's much more than that. Vitamin B12 helps your body produce healthy red blood cells and carries oxygen throughout your body. And it helps maintain the protective covering around the nerves, called the myelin. And when vitamin B12 levels become too low, nerves don't communicate properly, which may contribute to numbness, tingling, burning sensations, weakness, poor balance, muscle fatigue, and symptoms that people often mistake for poor circulation. If someone truly has a vitamin B deficiency, correcting that deficiency can improve nerve health over time. But it's important to remember that it won't reverse blocked arteries or treat every cause of poor circulation. Here's something many people don't know. After the age of 50, B12 deficiency becomes much more common because the stomach naturally produces less acid, making it harder to absorb B12 from our food. Long-term use of acid-reducing medications such as proton pump inhibitors or H2 blockers, as well as metformin used for diabetes, can further reduce absorption. People who eat very little meat, fish, eggs, or dairy products may also be at greater risk. Now, let's talk about what you can do beginning today. First, walk every day if your healthcare provider says it's safe. Your calf muscles are often called your body's second heart because every time they contract, they pump blood back up towards the heart as well as the brain. Every 20 to 30 minutes of walking most days of the week can support healthy circulation over time. Second, don't sit for long periods of time. Stand up every 30 to 60 minutes. Walk around the room or perform some simple ankle pumps or calf raises to keep your leg muscles active. Third, stay well hydrated because healthy blood flow depends on proper hydration. And fourth, if you smoke, make quitting one of your highest priorities because smoking damages the lining of the arteries and reduces circulation. Fifth, if you have diabetes or pre-diabetes, keeping your blood sugar in check under good control is one of the best ways to protect both your nerves and your blood vessels. 6. Maintain healthy blood pressure and cholesterol levels through healthy eating, regular exercise, and following your healthcare provider's recommendation. 7th, include foods naturally rich in vitamin B12, such as salmon, sardines, tuna, lean beef, eggs, dairy products, shellfish, and fortified cereals if needed. And if you think you may be deficient, ask your healthcare provider whether checking your vitamin B12 levels makes sense before starting high-dose supplements, because identifying the cause allows you to receive the most appropriate treatment. One thing I want you to remember is this: don't chase miracle cures. Chase the correct diagnosis. Vitamin B12 is extremely important for people who are truly deficient, but poor leg circulation may also be caused by narrowed arteries, diabetes, nerve compression, thyroid diseases, or other medical conditions that require different treatment. If one foot suddenly becomes much colder than the other, if the colors change, you develop sores that won't heal, or you experience severe leg pain while resting, don't wait. Seek proper medical evaluation, because those symptoms may indicate more of a serious circulatory problem. The bottom line is this: your body whispers before it screams. Cold feet, leg fatigue, numbness, tingling, burning, cramping while walking, or changes in balance should never be dismissed as simply getting older. They may be your body's early warning signs that something deserves more attention. So the earlier you identify the cause, the sooner you can take the right steps to protect your nerves, support healthy circulation, remain active, and enjoy a healthier future. If you found this video helpful, please share it with someone you care about, because this information could encourage them to seek help before a small problem becomes a much larger one. I hope this video was helpful. Please share it with your friends and family. Leave your comments below, and most important, make it a great day. I'm Dr. Alan Mandell.